So now a lot of people have difficulty to understand what is bronchiolitis and what is the pathophysiology of bronchiolitis and what are the signs and symptoms and how we will manage bronchiolitis in a hospital setup. So now I will teach you what is bronchiolitis actually. Bronchiolitis actually means has two terminology. One is bronchioles, another is itis. So bronchiolitis consists of two terms. One is bronchiole and one is itis. Now bronchiole means these are the small airway. Itis means inflammation. So bronchiolitis means so bronchiolitis means inflammations of small airway. Inflammation of small airway. So if we draw a lung and see how what happened in bronchiolitis. So this is the trachea, this is the main bronchus, these are the secondary bronchus, and then the tertiary bronchus which appear, and then it goes into the lung and divide and form the small bronchioles which may be situated here as like this. So the inflammations means there will be acute inflammations, there will be edema and narrowing of those airway. So to understand it better, very better, I will show you what is the pathophysiology of bronchiolitis. Pathophysiology of bronchiolitis. So what happened if this is a symbol, this is your upper airway, and it leads to lower airway. So when we inhale those viruses or some agent which will cause bronchiolitis, we inhale through this upper airway, and first of all they will create an inflammation in the upper airway. So what will be the symptoms? The symptoms will be runny nose due to inflammation of this upper airway. There will be runny nose and nasal stuffiness, redness of eye. And when this inflammation will occur, there will be outpouring of water, and that is called exudates, and these exudates may trickle down to the lower airway and may trickle down and may cause cough. So these are the primary symptoms before actual development of bronchiolitis. Now what happened next? Now what happened next? This inflammation of this upper airway generally extend into the lower airway, and infect those small airways and causing inflammation that will lead to bronchiolitis. Now there a question may arise, so what is the difference? What is the difference between common cold and bronchiolitis? In common cold, infection doesn't spread to the lower airway. But in case of bronchiolitis, infection spread to the lower airway. To the lower airway. So infection to the lower airway. Now what happened after infection? What happened after infection of those lower airway? So if we draw a lower airway, what we can see that this lower airway has this is the lumen, and this is the epithelial surface, and it has those muscle layer but has no cartilages, so they are collapsible, no cartilages, so they are collapsible. So what happened actually after bronchiolitis, this lumen, if we draw it a little bit large, what happened that this epithelial layer is inflamed. This epithelial layer is inflamed, causing outpouring of water, exudate, and everything, lead to narrowing of this airway, narrowing of this airway. So what will happen? There will be decrease airflow through this narrow airway, decrease airflow through this narrow airway, leads to hypooxygenation, leads to less oxygen supply to blood, and to maintain the homeostasis, what our physiology will do is that it increase the respiratory rate, that leads to symptoms of breathlessness, and also it will increase heart rate to circulate more blood to compensate this hypoxygenation. So, and if oxygenation lead to more production of desaturated hemoglobin, lead to cyanosis or bluish discoloration of lips and other peripheral parts. But we all know that everyone is not suffering from bronchiolitis, so there must be some risk factors. So I will discuss those risk factors that will lead to more chances of getting bronchiolitis, and what are the main sign symptoms after that. So what are the risk factors? First of all, age. Bronchiolitis generally affect 1 to 2 years of age group. But most commonly occur in 1 to 6 months of age group. And what will other risk factor? The season means those season like winter, winter, rainy season. This time more chances of getting infections. Why? Because they all stay together, all family member stay together and viral infections spread viral infection. So season after season, another one is close contact. This is like close contact with anyone the who is spreading viral infection, spreading respiratory viral infection or viral infections. And another one is not everyone is getting infected, so there must be some role of immunity. So decreased immunity of child is more prone to getting infected and spreading of infection to lower area. Now, after immunity, the other features are anatomical factors. What anatomical factors? If there is an abnormality in the bronchioles, if there is abnormality in bronchioles that causes stagnation of mucus, so they are more prone to getting infected. Now, and some other risk factors like congenital disease. So congenital diseases are cystic fibrosis, more dried mucus, less mucus come out, stagnation, more chances of getting infection. Cystic fibrosis and others are congenital heart disease. Congenital heart disease. So we have discussed the risk factors. Pathophysiology, and now the topic of discussion is signs and symptoms. So signs and symptoms. Now, in signs and symptoms, first is symptoms of our respiratory tract infection. This is common cold, runny nose, redness of eye, nasal discharge. Actually, runny nose is also called nasal discharge. So nasal stuffiness, cough, symptoms of airway narrowing, breathlessness. Here is a catch. In bronchiolitis, there is severe respiratory distress. In a range of respiratory rate of 60 to 100 per minute. After breathlessness, there is symptoms of bluish discoloration. If there is hyperoxygenation, bluish discoloration. Then what are the signs? Signs are increased respiratory rate, increased heart rate, cyanosis, uh, chest retractions, chest retraction, and due to hyperventilation there is expansion of chest because mucus causing blockage of airway during expirations. There is accumulation of air in lung field lead to hyperinflation of lung field. So there may be presence of hyperresonate lung field, and due to hyperinflation there is a push down of liver. If you palpate parabdominally, you can palpate a liver. When you put stethoscope on chest, you may get wheeze due to narrowing and cramps due to mucus production. There may be chances of getting bronchial breath sounds also due to collapsed area of lung field. How it happens? It happens due to those terminal part of lung which are blocked, so during expiration no air can out, and the air trapped here when absorbed there is collapse of that part. Now these are the clinics you can get, and laboratory investigations should be done. Chest x-ray must be done to exclude other causes of respiratory distress. Maybe pneumonia, or something others. So what we will get in chest x-ray? Due to inflammation of airways, due to inflammation of intra-airways, inside the airways there is also inflammation outside the airway that leads to this is bronchioles, and this is bronchioles. This is inflammation inside and also outside, leads to an coughing that is called peribronchial coughing. So in chest x-ray you will get one hyperinflated lung field and peribronchial coughing. So this is chest x-ray of bronchiolitis, and you can see Is a chest X-ray of bronchiolitis, and is a chest X-ray of bronchiolitis. So these are the peribronchial coughing. These are the peribronchial coughing. These are the peribronchial coughing. Okay, this is the peribronchial coughing. You can see here. This is the peribronchial coughing, and if you can see, this is an hyperinflated. This is an hyperinflated lung field. Now, how to see hyperinflation, and for that, now how to see hyperinflation. For that, how to see hyperinflation? Two rule is that you can count ribs. If anterior ribs are more than 6, then hyperinflated lung field. And if this is a chest X-ray and this is the dome of diaphragm, you can join these two line. You can join these two line. So, and the distance between these two things is that if it is distance is greater than 1.5 centimeter, this is dome of the highest point of dome of diaphragm and this basal line, then chest field is hyperinflated. So before the treatment, I would also like to identify cause. Any viral infection can cause bronchiolitis, but most commonly is RSV, adenovirus, influenza virus, etc., coronavirus. So treatment options. First is treatment options. So there is a bronchioles, there is edema, there is contraction of those musculatures, and there is airway narrowing. So what is you can do is that you can decrease it by increasing viscosity of mucus. So 3% NaCl you can give as nebulization. Another is short acting beta 2 agonist that decreases this airway narrowing, adrenaline nebulization decreases muscle contraction, but the main treatment is oxygenation. Main treatment is oxygenation, means O2 inhalation, oxygen inhalation. Another is hydration, as high respiratory distress is present. So you have to hydrate the patient. And prognosis is that bronchiolitis has very good prognosis. Complication.
According to MedPage today, a bad prognosis means there is little chance for recovery.
Very good prognosis. Complications are very rare, but may occur, like respiratory failure, that needs ventilation. Secondary infection to bronchiolitic epithelium is very rare. Now another thing is that within 48 hours, within 48 hours, bronchiolitis improves. So guys, if you have understand bronchiolitis properly, comment on my channel, on my videos, and subscribe my channel. Thank you.